Commons, where they will choose a speaker in the next few minutes. We think certainly the latest round of voting will happen, and we'll have full coverage for you. This hour we're talking about social care and how it can be improved. Dr. Ruth Allen is the Chief Executive of the British Association of Social Workers. Thank you for joining us. I've seen the figures. Spending on adult social care in England has fallen by 3% since 2010. The number of adults receiving publicly funded care packages is also down. How can that be?
I think that social care has really not been a priority for the governments that we've had throughout the last 10 years. I think the emphasis has been obviously on reducing public spending, getting public finances under control. And in many ways, people who need social care are some of the least visible. And it's been really the progressive increase in hidden suffering of people not receiving adult social care over that time. And people are making a lot of noise about it. People who are directly affected, the organisations, our own organisation. But really, this is about very vulnerable people quite often who really have not had a voice in big politics. And this has been going on for far too long.
The fact that there are still plans in the offing, hopes of policy announcements after many years of procrastination and delay, why is it? I mean, it's not an easy problem to solve, but why has it proved so tricky for politicians to grasp?
I don't really know. I think we were hopeful when we heard back in 2017 that we were going to get a green paper. I think Jeremy Hunt was talking then about really starting to really focus on social care. The Department of Health became the Department of Health and Social Care, and there was a sense that maybe social care was rising to the top of the agenda. Other political matters have kind of drowned out some of these really important domestic policies. And really, when we hear about all the pressure on the NHS, and we're hearing much more about that now, we all have to realise that the gaps in social care can completely make the problem for the NHS much worse, because social care can prevent problems escalating. They can prevent not only personal misery, but actually demand on other services.
Thank you. Dr. Ruth Allen, Chief Executive of the British Association of Social Workers. This text says, Eddie,